Hi, thanks so much for stopping by today. We are going to be doing a workout that's appropriate for rotator cuff strengthening and also rotator cuff injuries. Of course, always check with your doctor first. Stop if you have pain. This is not meant to diagnose or treat whatsoever, but I can tell you they are common exercises I give to my patients who do have rotator cuff weakness, and that can come across in many different ways. Sometimes it is an impingement or a bursitis or a tendonitis in the shoulder. It can be a tightness up in the neck or even headaches. It can also be tennis elbow or even down into wrist pain. All of those things can come back to somebody needing a stronger rotator cuff. But again, I want you to check with your doctor. Stop if you have pain. So I do have a stretchy band here. It isn't necessarily necessary, but it is definitely helpful to have this. So I would recommend having it for the video. There are some things you can do without it, but there are some things that we'll definitely need it for, okay? So just have it to the side. And first, I just want you to sit nice and tall with your shoulders down and back. And I want you to find a tall posture. A lot of times rotator cuff weakness can be traced back a little bit to our posture, which is here a lot of the times, rounded forward, sitting at a desk, sitting at the car, bending over. This causes a stretched out rotator cuff in the back and tightness in the chest. So we need to work to get the chest open and the shoulders down. So what we're going to do, and you can do these standing as well, you're going to reach your hands back, clasp your fingers together if possible, and then if you can, get the heels of your hands together, but that might come later. And you're just going to reach the knuckles down and slightly back and think about an open chest. This is something you can do all day long. Take breaks at the computer, take breaks from work, or helping the kids with homework, and make sure that you're opening up that chest. And just breathe. We usually don't hold stretches long enough either, so I'm going to make you hold it a little bit. Good. One more deep breath in here. Okay, nice job. And then you can gently release that and let the shoulders go, okay? So that's your first lesson, is make sure that you're starting to pay attention to what you're doing and how you're standing throughout the day. All right, so let's go ahead and take the stretchy band. You're gonna hold it in both hands, elbows at your sides, and let's pull apart and then together. So the key is keeping elbows in at your sides, and again, keeping the collarbones open. So this is working your external rotation of your shoulder. You can, and some of you, if you've done these rotator cuff type exercises before, you've probably had a stretchy band. You throw it in the doorway, close the door, and you can do that as well. So if I'm the doorway, then I'm just doing one arm at a time. And that's fine. I just find this is a quicker way because I can do both at the same time. But it does the same thing. But you can't do this sitting here and holding weights and expect the same. It won't be the same. Okay? If you hold weights doing this exercise, just like this in this position, it's going to be your bicep, much more than your external rotators. Now, there is a way to do this with weights, but you have to lay on your side to do it. So just keep that in mind. All right, nice job. Shake your shoulders out. Step your grip a little bit wider. Bring your arms in front of you and exhale to pull apart. And inhale to come together. Now, the key to some of these, many of these, for your shoulder is pain-free movement. It's okay if it's weak. It's okay if it burns a little just because it's working, but you do not want sharp pains, and you don't want to recreate your shoulder pain. If so, then you're going too far. You really don't, there's not very many times that you push through shoulder pain, all right? That's usually your indicator it's going too far and it needs to rest. So just make sure it's a smaller motion. You can also do these laying down, both of these, and that might feel a little better than sitting up. Last two. And last one. Nice job. Again, shake out your shoulders. I'm giving you some of the harder ones here to start with, actually. Now, you're gonna find your grip again, even a teeny bit wider maybe than what we just did. Hold with both hands, but keep your left hand down at your side. So that's gonna be the grounding arm. This right arm here is bent. Think Saturday Night Fever. I'm gonna lift up and open, bend, and come down. And if it's too easy, you just have a closer grip. So bend and then open, bend and come down. This should be, and it usually is, a little bit harder than the others. So think about shoulder staying down, which means I don't want to see this happen, okay? Especially if you're working into some shoulder rehab and changing your patterns. Make sure that you're keeping that shoulder down. Open, bend, and come in. Let's do 2 more. Good, last one. Nice, and then you just switch. So the right hand is now gonna ground down, left lifts, and again, open, bend, release. Staying nice and tall in your spine. And this as well, if you do prefer to tie a knot in your band and throw it in the doorway or around a door handle, that's fine. You can do this right there too. You would just need it low on the door so that you can lift up and open like this. Let's do 3 more. 3. Good. And 2. Last one. Nice job. So let's set this to the side. And speaking of sides, you're gonna lay down on your side. So I'm gonna do both sides because I wanna keep you even. If you do have an active shoulder injury, you might, let's say it was my right arm that was injured, I might not wanna lay on my right side. So you could just do the other side so that you're working the side that's injured. You'll see what I mean. But don't force yourself to lay on the injured side if it's painful, okay? I'm just gonna show you both sides to keep myself even and anyone else out there who's more working preventative. All right, arm's gonna be at your side. You can be right here propped up or you can be flat down on the ground. Exhale, I want you to lift it up to start. And then inhale, lower it back. Okay, so shoulder again stays down. We're retraining a movement pattern here. If you have very light hand weights, like 1 or 2 pounds, you can use that here, but I don't want anything heavier. Okay, now we're gonna take it into a circle. Bring it forward and around, back, and down to your side. So we're trying to regain some motion, but again, do it in a way that also allows the shoulder blade to move and your upper spine to move a little bit. And reverse directions, so back and around in front. Last 2. Last one. Nice job. And if you are like me and you're just doing this for prevention or to help keep your arms strong, go ahead and do the other side. But like I said, if you have an active shoulder injury and it's not comfortable to lay on that side, then that is fine. No problem. Okay, arms straight up and down. So, I don't know if you noticed that the light's changing a little bit as we go along. It's because it's the eclipse. I'm filming this right in the middle of the eclipse, actually. Because I don't have special glasses, there's no point in me trying to go watch the eclipse anywhere. So, I wanted to film. But it is interesting, because I don't know if you've noticed, like when I look outside, the sky is completely blue. But I noticed that there's this big shadow coming I can see it in the camera filming. It's so interesting. So we're making history, folks. Filming during the eclipse. Okay, so arm forward and around and back. So interesting. They say the eclipse is time for new beginnings. So if you have a shoulder injury, that's where you're putting your energy right now, new beginnings. Feel confident that it's going to get better. Reverse directions. Let's do 2 more. Last one. Nice job.